introducing each participant. I'll give you their names. We have the 5 panelists, and then we will get right into the talk so that we have a little bit of time afterwards for questions. I'm happy to introduce you to the following. Andy Knight, who is a professor of political science at the University of Alberta. Jonathan Luckhurst, who is an associate professor at the School of International Peace Studies at the Soka University of Japan. Winston Dookeran is a professor at the International Diplomacy Institute of International Relations at the University of the West Indies. Srikanth Kondreddy is a research scientist with the Brunschot Research Institute at the University of Ottawa. And Afoke Isike is at the University of Pretoria, and he is a professor of African politics, African development, and international relations at the University of Pretoria. So we're going to start with Andy, who will give us a little bit of an overview, and then we will be followed by the next 4 presenters, and we will have some time at the end for some questions. So I'm going to hand it over to Andy right now, who will get us started. So thank you.
Thank you very much, Erin. It's a pleasure to be here and to be able to sort of lead off with the year ahead overview. I'm Andy Knight, of course, from the University of Alberta. 2020 is our annus horribilis. You've probably heard that term before, but with all due respect and reverence to Her Majesty the Queen, 1992, as horrific and as turbulent as it was for Queen Elizabeth II, cannot come close to the tumult of 2020. The collapse of the 3 royal marriages, a sex scandal involving the Duchess of York, and the devastating destruction of much of Windsor Castle by fire cannot even come close to the carnage and death and suffering wrought by the novel coronavirus, COVID-19. As of today, December 4th, 2020, there have been 65 million cases of coronavirus COVID-19 worldwide. And since the 1st of January 2020 to the present, over 1,500,000 people have died as a result of the virus. Regionally, the statistics are even are also very ominous in terms of infections and deaths. In Africa, over 2 million cases have been reported so far. Most of those cases in South Africa, Morocco, Egypt, and Ethiopia. In Asia, 16 million cases. 5 countries reporting most cases are India, Iran, Iraq, Indonesia, and Bangladesh. In the Americas, 27 million, almost 30 million cases, with 5 countries reporting most cases are in the United States, Brazil, Argentina, Colombia, and Mexico. In Europe, 18 million cases, most cases reported from Russia, France, Spain, United Kingdom, and Italy. And the list goes on. The number of deaths have also been ominous. In Africa, 52,844 deaths. 5 countries reporting the most deaths are South Africa, Egypt, Morocco, Tunisia, and Algeria. Asia, 277,963 deaths. America, 744,091 deaths. In Europe, 431,000 dead. So this is a tremendous problem for security. To put things in stark perspective, the United States, the most powerful country of the world, seems unable to adequately tackle the security threat of this global pandemic. According to Dr. Jonathan Reiner, a cardiologist and professor of medicine at George Washington University, by this time next week, we are going to be talking about 3,000 deaths a day. That's 9/11 every single day, according to him. As we look to the year ahead, there are a number of important issues that the Canadian government should consider, particularly with respect to its own perspective on governance and health security in light of the COVID-19 pandemic. This pandemic has made us all aware, all too aware, of the reality that we are living in a time of flux and change, a period in which the traditional Westphalian notion of the container concept of the state is no longer viable. Back in 1992, the same year on which Queen Elizabeth mused that she could not look back on that year with undiluted pleasure. My colleague, the late Mark Zacher, drew attention to the decaying pillars of Westphalia. A Canadian foreign policy and defense document that is wedded to any traditional strategic studies concept of security is no longer tenable. This pandemic has also reminded us of the conceptual and practical shifts that have been occurring in an era in which we can only label as intermestic, where the traditional lines between the international and the domestic have become so blurred as to make the governance of newer security threats, like the global pandemic, much more difficult, much more complex. In 1977, Robert Cohen and Joseph Nye were already sounding the alarm about complex interdependence. They brought attention to the fact that the intensification of globalization has made it almost impossible to develop policies in silos. Kimberly Crenshaw, when she coined the term intersectionality some 30 years ago, it was a relatively obscure legal concept, but it helped to give more meaning to complex interdependence paradigm of Cohen and Nye. This pandemic has also caused us to reflect on the idea of human security. That was championed by Lloyd Asworthy when he was Foreign Minister of Canada. Joe Jockel and Joel Sokalski has pointed out that Asworthy, while he did not coin the term human security, because it was emerged out of a 1994 report of the United Nations Development Program, Asworthy was a norm entrepreneur. He put meat on the bones of the concept in 1999 with his interpretation of human security as a threat, meaning the safety and the people from, safety of people from both violent and non-violent threats. He helped to cascade this new norm and shifted foreign policy and defense policy of Canada and other countries by emphasizing the need to put people first as a principal point of reference in international affairs. This pandemic also reminds us of the broadening and deepening of the concept of security, a subject that was pivotal to an article written by Canadian academics Keith Krause and Michael Williams in the Mershon International Studies Review of 1996. Picking up on the post-Cold War analysis of authors like Barry Buzan, Krause and Williams tried to thread the needle between dominant neo-realist views on strategic studies with critical approaches to the subject of security. I would argue that the critical approaches are now much more relevant today, particularly because of the global pandemic. This pandemic is causing us to rethink the nature of governance at every level: local, municipal, national, regional, trans-regional, and global. Quite clearly, the pandemic has exposed poor public health systems and infrastructures for governing such security threats in regions like Africa, but also in North America and Europe. It has exposed flaws and weaknesses in governance models that have the facade of liberal democracy, from Trump's America to the illiberal democracies of Brazil, Hungary, Russia, and Turkey, etc. Michael Ignatieff once made a distinction between liberal and illiberal democracies back in 2019. I think that's very important to take a note of that. This pandemic has finally rekindled the debate about the need to put in place an architecture of transversal and multi-level governance. Amitav Acharya has labeled it multiplex governance, whose main elements will be based on principles of resiliency. And I have also added the notion of the principle of subsidiarity. That principle has its origins in the Roman Catholic Church with Pope Pius's the 11th encyclical letter, Quadragesimo Anno in 1931, in which he pushed the notion of a principle in which a central authority have a subsidiary function performing only those tasks which cannot be performed effectively at the more immediate or the local level. So building resiliency in the security architecture, I think, is one of the major aspects that we can learn from this pandemic. I will close it there because I know we have others right now who are dying to get into this conversation. So I'll close it there.
Thank you very much, Andy. We'll turn to Jonathan Luckhurst now, please.
Thank you very much. Yeah, that was a very interesting start. I think, I mean, myself and Andy have been working on a Think 20 policy brief, which engages with these kinds of issues. And so some similar themes, I think we agree very much on there. So my focus today is looking at the G20 context, what I call the transversal challenges of COVID-19 for networked G20 governance. And so I'll just explain a few issues there and conceptually. So my focus, I mean, already just now we had this panel on China, and I think G20 is a very interesting context, obviously for engagement between countries like China and the United States, obviously, and several other countries from quite different backgrounds, perspectives, and places in the world. I think that's an advantage. I think that's a benefit of the G20. Going back a decade or so, you saw the cooperation during the global financial crisis, where I think the G20 was quite crucial in bringing the US, China, and others together in finding a path forward, a multilateral path. So I think the G20 is very useful in that sense. My focus on network G20 governance is really recognizing that the G20 is not just a forum of member states. It's not just, you know, it does bring in and engage with other kinds of actors, non-state actors, you know, civil society actors, various kinds of actors that are very much engaged with the G20 through the official engagement groups, for example, intergovernmental bodies as well, of course. So this is where I think the G20, it has become a kind of hub, what Andrew Cooper calls a focal point. I tend to use the phrase hub more often, of contemporary global governance. So by bringing in these different actors, this kind of transnational pluralism in the current context has facilitated, for example, engagement with Gavi, the Vaccine Alliance, and more broadly with also key actors from the Global South. Canada, of course, has been very positively engaged with the G20 from early on. Of course, Paul Martin was a big advocate of a G20 leader forum. So I think that's where Canada has played a very positive role over the past, even before the Leader Summit, going back 20 plus years. In the current context, I think the G20 has been crucial in, and potentially can play a stronger role in meeting what I would also call, similar to Andy, the transversal challenges of the current pandemic. Transversal in the sense of being kind of multifaceted dimensions, economic, social, environmental, health dimensions, of course. And I think that's where this tendency of many policymakers to fall into a trap of kind of dichotomizing between economic objectives and health objectives. I think that's really a false dichotomy. And I think that's where we need to see these issues in a more holistically interlinked way rather than in policy silos. I think that's an area where hopefully the G20 can help because it has such a broad policy agenda. And I think this year the G20 has focused a lot at the recent virtual summit on COVID-19, and indeed the Italian presidency next year will similarly be focused on COVID-19. There will be a global health summit, I should note, in May, which will be kind of under the auspices of the Italian G20 presidency plus the European Union, who are going to co-host the event. So yeah, I think this kind of networked relations within the G20 helps to facilitate cooperation, and I think that's really a positive of the G20. Now, in terms of the policy brief that we actually put together for the G20, for the Think 20 Engagement Forum, we have actually advocated a working group on pandemic preparedness and institutional resilience as one possible way that the G20 could help. That hasn't happened yet, but possibly. Also, we're strongly emphasizing the idea of policy preparedness and institutional resilience. So not just dealing with current circumstances, but also looking forward to future pandemics and the possibility of these being perhaps more recurring events more frequently. Now, beyond that, I mean, there were problems. I mean, we weren't totally unprepared for the pandemic. I mean, we did have the World Health Organization's 2005 international health regulations. Unfortunately, there wasn't, I think, enough emphasis or compliance or implementation on those regulations. And that's where hopefully now the G20 could possibly contribute to reinforcing those kind of regulations going forwards. Yeah, so the idea of transversal global governance in this sense, I think, is very compatible with, for example, the UN Sustainable Development Goals in terms of the idea, the ethos, dealing with these issues and in the kind of complex array of issues that are very much interlinked. And also, we advocate looking at the global north and the global south to look at the issues that are particular to the global south. Which are also important, have a kind of reflexive importance for the global north, because obviously a global pandemic is not going to be tackled until you tackle it in the global south as well as the global north. And that's where vaccine nationalism, for example, is a serious concern at the moment. And I think that's where the G20, hopefully by engaging actors from the global north and global south, will help to overcome possible risks of vaccine nationalism, reducing the spread and the sharing of vaccines and other medical use tools for dealing with the pandemic with the global south. So, and obviously the global south has a lot of challenges. I mean, you've got to think about things like the economic disparities, the issues about subsistence wages. So it isn't easy for people in the global south to just stop working, because when half of your population in some countries is reliant on daily wages, perhaps sometimes in the illegal economy, then you need to think about the conditions in those different contexts. And I think that's hopefully where networked G20 relations, cooperation, governance can really enhance the role of the G20 as a forum. So yeah, I do feel then that the G20 has the strengths, the capacities, and the potential to make a stronger contribution to multilateral cooperation on COVID-19. And well, just to conclude, I think there are clear failings in the international response up until now. I mean, especially in the early months of the pandemic. Hopefully on vaccines, we can be more effective in terms of multilateral cooperation. Hopefully the G20 and it's in the upcoming Global Health Summit in May can be very positive there. I do think that by cooperating in this way, this kind of helps to share expertise, share insights on issues like challenges, digital challenges, issues about working from home, logistical challenges about vaccination, challenges with the Pfizer vaccine, for example, which is very difficult to store, and there are questions, concerns about whether that can be easily shared in the global south, stored as easily. Political challenges, anti-vax conspiracies, vaccine nationalism, as I mentioned, and also those challenges to the global south. So I think those are areas where dealing with those differences and challenges, I think the G20 is a good forum for that by bringing actors together. Again, not just state actors, but also civil society representatives, think tank representatives, researchers and academics such as ourselves. I think that's where the G20 holds this potential to really help deliver positive results. Yeah, well, it's been good to talk with you all, and I think that digital engagement like this is another area where hopefully in future we have learnt lessons in global governance that digital tools can help as well to increase collaboration. So thank you very much.
Thank you very much, Jonathan. We'll turn to Winston Dookeran now.
And thank you very much, Erin, and it's a pleasure to see you. And thanks to Andy for inviting me to this very, very prestigious get-together here today on this conference. I would like to share some views, some of which I've already learned a lot from the previous panel and today from what I've heard, both from the two presentations before. But I'd like to look at some of the issues from a perspective from someone outside of Canada and from someone who have been looking at these issues in the context of what is likely to be the changing shifts that are taking place globally, and then more specifically on what are some of the tipping points in the pandemic for the Caribbean region. Firstly, there's no doubt that the next year, the United States of America will once again take its seat on the head table of global affairs. However, it will not be the same as it was before. And I think it's important to recognize that. It will be confronted by a new seating arrangement, one in which its sphere of influence cannot be taken for granted. Not, of course, only because of this age of contagion that the pandemic has brought upon us, but also because prior to that, and because of it, and subsequent to it, there has been a very subtle shift in the alignment of political forces. Some have indicated that the global order is about to be broken down. Whether that is so or not, I think it is undeniable that we will face global political stress in the year ahead. And in what way will that manifest itself? Already we have begun to see in measures of recovery to the pandemic devastation, a new change in logic in economic management. For instance, the term deficit financing was once viewed as an alarmist term. Now it is seen as a necessary term. And as economists put it, the old paradigm looks tired. Health security is on the daily radar screen, as was so well articulated earlier on by Andy. And the risks are widening and rising, and new risks are surfacing. Consequently, we are facing a period in which the alignment of world power is shifting in uncertain directions. The first recognition of that uncertainty is the void in global leadership, emerging from the pandemic and indeed the global recovery efforts. And this is likely to spill over into the new order of things. As we speak today, there is change in motion and there are questions. There are those who are re-evaluating the antiquated orthodoxy of recovery economics, where all economic ideas are under stress. There are those who are calling for emergency G20 gathering, and I was very pleased to have heard the last speaker talking about the G20. Will it fill the void? The fact that they eventually agreed to a virtual meeting in April 2021 will be looked at with great anticipation, but also with great trepidation, that it may not necessarily fill a void in the leadership that has emerged. And thirdly, there are those who are advancing priority claims for the vaccine, as many will see the light in wealthier nations, but leaving low-income countries exposed for several years. How indeed would the risk of the spread be eradicated? These are some of the trigger points in the stress test, but they demonstrate something much more telling: a lack of coherency on how the politics will respond on a global scale. This disruption will spill over into regional and national arenas. Tip O'Neill, the former Speaker of the US Congress, once famously said, "All politics is local." While he may have been referring to domestic politics, his point undoubtedly extends to global politics. What, therefore, the trends in thinking on the perspectives of the year ahead? Firstly, assertive political postures will not be the sole preserve of big powers. And we will witness new assertions around the head table of global affairs. In Europe, advancing a pathway to a new focus on strategic autonomy in a more resilient politics. The quest in the Far East to build immunities to global political rivalries. The intensifying voice of Africa to promote greater continental diplomatic leverage. The refusal of Latin America to be left out of the world to come as it connects the dot globally. And the quest of small countries like those in the islands of the Caribbean and the Pacific for what I term survival and sustainability. Sorry, the perspectives have changed, and therefore the conversation in the global table is likely to take some new dimensions. It will be foolhardy to expect that in the Biden administration, they will continue from where they left off. I want to end by identifying a few key issues in this political stress test analysis. On the health security issues, the effectiveness of regional pandemic surveillance and coordination of health security measures, the adoption of a sustainable self-financing instruments to finance universal health coverage for the society, including the poor, and democratizing access to global health and research products in medical science, like the COVID-19 Vaccine Global Access Facility, which will require a revitalization and reform of the World Health Organization. And on the governance issues as it affects the small economies of the world, the resetting of the platform of financial flows in the working of the international financial institutions and the global marketplace. The diplomatic initiative to establish channels of communication with the centers of global power. And the focusing on some technical issues like measuring the Universal Vulnerabilities Index as a basis for building relationships, and on the very important upcoming subject of ocean governance and security for small island developing states, what has been called SIDS. These are some of the tipping points in this political stress test ahead of us. And therefore, in formulating a perspective for the future and in trying to set the groundwork so that we can indeed find new points of departure against what has taken place, so that we can see new prospects of success, not from the old institutions, but from the institutions that must now respond to these new changes that we will now begin to witness coming out of the pandemic, coming out of the developments of the last few years in the conduct of international relations, and coming out on the prospect of a new world that is likely to emerge and calling for more, not for less, in trying to bring about a new sense of confidence that it can tackle the future with a greater amount of precision and a greater amount of sensitivity. So I leave this as thoughts in what I describe as a political stress test, which we must now all undertake in different parts of the world to identify the agenda in foreign policy and international conduct of relations. Thank you.
Thank you very much, Winston. We will turn to Srikanth now, and he will do his presentation, and then we will conclude with Christopher. So go ahead, Srikanth.
So thank you, Erin. Good morning, all. I'll build on the points which Andy has mentioned and the previous speakers have mentioned. So as Andy mentioned, resilience is the key term, and as Jonathan mentioned, institutional resilience is the key term, and then the Winston who mentioned about surveillance. So building on these three key leads, I'll present and I'll go into. So in the context of Caribbean region, we know the pandemic had devastated effects all across the world and across the regions, and the Caribbean region is one region which was also badly affected by this pandemic. So as we know that the Caribbean is a region of small island development states, and there are at least 13 sovereign states, and then on 40 million different ethno-linguistic diversity groups that we can see there in this region, and on an average of 50 million travelers who come to these islands in annual basis. So that means, which indicates a highly tourism-dependent economic region. So in this region, there are some. It's highly vulnerable to climatic events and then the man-made events, and then the region is also prone to infectious disease outbreaks quite often, as we have seen recently. A couple of years back, like in 2015, there was Zika outbreak in this region, often dengue and the chikungunya outbreaks. So, I mean, in a nutshell, this region is prone to zoonotic disease outbreaks as well as non-zoonotic disease outbreaks that we have seen this in past, and then the COVID is the latest addition to these outbreaks. So the one reason why this region often have these kinds of outbreaks is that the reasons, as we see in the literature, so lack of surveillance mechanisms, robust surveillance mechanisms in this region, and at the same time, so very relatively loose governing structures for chemical and biological, radiological, nuclear threats. So these are the two gaps that we can often see in this area. That's what the scholars and literature indicate us. So in order to build the resiliency in this region and to be prepared for the future outbreaks, infectious disease outbreaks, and then to bring resilience into the systems and then in the region as a whole. So are there any opportunities to build that kind of resiliency? Yes, we do have global governance frameworks to build resiliency. So I'll just want to introduce you the concept of the framework of international health regulations, which 196 member states agreed upon to this international regulations, which is a legal binding document, which is a key governing framework for global health security. And so it was it has a long history because in the 1850s there is international sanitary regulation, so that's the context. So when the regulation started for pandemic preparedness or disease outbreak preparedness, and there were repeated revisions in these regulations, and then recently we have post-SARS, we had the leaders, the member states agreed to develop revised international regulations framework. This was adopted in 2005, and then which came into force in 2007. So it was expected to, the member states are expected to comply to these regulations as a whole, and to build capacities, core capacities in each member state, as indicated in the regulations IHR framework. So what does this IHR framework core capacities look like? So it primarily indicates, suggests the member states to build 8 core capacities, developing legislations, national coordination, focal points, surveillance, laboratories, human resources, so risk communications. So these are the 8 core capacities that each member state should develop. At the same time, so it also provides some kind of peripheral capacities are required for radiological nuclear threats as food safety and zoonosis cases. So altogether, there were 8 core capacities and 5 additional core capacities expected to be fulfilled by each member states. And as of today, the fundamental gap that we have found in the IHR international health regulations is that, so despite being a decade-old framework, and when member states agreed to fulfill these, build these capacities, and then to comply in letter and spirit. So as of now, as of today, of course, and 2/3 of the states, member states, had to fulfill or had to comply or had to build these core capacities in their respective national context. So Caribbean is one region. Caribbean region is one region where these core capacities are also need to be established by in many member states. So as per the latest current statistics, if you go by where are we at the compliance process. So according to the WHO, World Health Organization reports, it shows that the global average of IHR compliance stands at 64%. Especially in the Caribbean region, it stands at 71%. And there is a significant variation within the Caribbean member states in compliance process. So, for example, Antigua and Barbuda has as low as 42%, and then the Jamaica has as high as 84% compliance rates. So there is a lot of variation within the Caribbean region and within Caribbean member states in terms of compliance in building these capacities. So there's lots of opportunities to work together and to build these capacities by the Caribbean member states in order to build a resilient system there and resilient surveillance there, and in order to have a robust health security process in the region. So this one. So as we are hoping to reopen the borders now, so there is an opportunity again so the borders needs to be opened, and in order to open the borders, there needs to be robust surveillance mechanisms at the ports of entry. As IHR international regulatory framework suggests, there needs to be core capacities and the compliance process, each stage and each level in each member states. For example, at the points of entry, that means naval bases and the airports and ground crossings. And at the same time, these regulations are expected to be strictly complied at the national level and regional level, as well as the community level. So we often see there is a limitation in terms of compliance in a national scale. Most often, the compliance can be seen at the national scale, and regional level and peripheral level. The compliance is very less, which is because probably not having the mechanisms not having the systems in place, and at the same time, lack of awareness among the people and the healthcare providers or the administrators. So this is the limitation. So for example, as I said, so as we're getting ready for opening borders again, so there needs to be a robust mechanisms to monitor the international travelers at the points of entry in the region. So there is an opportunity again to have a coordinating mechanisms across region in order to have a safe border reopening. So as Mia Motley, the Prime Minister of Barbados, recently said, in order to have a robust pandemic recovery plans, so she advised and she suggested to have a regional approach. So for pandemic response as well as pandemic recovery. So, and I'm building on that point and then saying that, so for now and for future health security in the region, so this is one area where we can, the Caribbean member states should work together and then to build the robust capacities there. So, and having a regional integrated approach for biosecurity is one such thing which can really help as we move forward in the region. So there are some, the primary thing here is that international cooperation in building these capacities. Often, not that every country has that kind of a technology and resources to build these core capacities. So there is an opportunity for international cooperation and then member states, apart from the Caribbean region, to work to come forward and to help and to build these systems there in the region. So, for example, in Canada is doing Canada and Caribbean Resilience Facility is already doing some incredible work in the region, which is a Canada Caribbean Research Facility is a single donor facility fund which helps to build climate preparedness and resiliency in the region. So they can take an opportunity, I mean, they can work further and then to see the opportunities to build these core capacities, IHR core capacities, in addition to the climate resilience in the region. So, and most of the Caribbean member states are part of the Global Health Security Agenda, and then Global Health Security Agenda is also facilitating to build these capacities in the region. So what I feel is that apart from, it's more than the international community, it's the Caribbean member states should work together and to build a much cooperative way to have these systems in place in a more robust way, and to have resilient health systems and resilient regional health security in the region. I'll stop there. Thanks so much.
Thank you so much, Srikanth. We'll turn to Christopher now, please.
Good morning to you all, although it's evening here in South Africa. I shall be talking on electoral democracy, bad governance, and public health in Africa. The core argument that I will make is that although, like Andy said earlier on, COVID-19 exposed weaknesses in public health systems globally, due largely to the kind of political systems in place, where in Africa it exposed the continent's poor public health systems and infrastructure as a result of the failure of governance, failure of politics, failure of democracy, and especially the electoral variant of liberal democracy, which is very prevalent in the continent. So I shall be talking along 4 lines, just a little statement on the crisis of liberal democracy, and then the failure of the electoral democracy in Africa, which, like I said before, is the variant of liberal democracy that is pervasive in Africa, and then how this leads to bad governance and the impact this has on public health in the continent, and then the last point of what needs to happen going forward. Probably also looking at how countries like Canada can help Africa. So generally, there is an established body of scholarship on the crisis of liberal democracy, focusing on different aspects. For instance, you have people like Kondreddy maintaining that liberal democracy is in crisis, occasioned by the processes of globalization. Others like Grayling talk about, the fact that representative democracy has been made to fail in the bastion of liberal democracy, it's like we have in America and Britain, due to insufficient checks on the political and economic powers of the elites. And then in a 2018 study by Levinsky and Ziblatt, they talk about a historical study, which was a historical study of the collapse of Western democracies over time and the erosion of unwritten norms of mutual toleration and forbearance, which served as the quadrails of American democracy in time past. And even Fukuyama, in a recent study 2 years ago, examined how the desire for equal recognition by some people and more recognition by others within liberal democracies have bred the politics of resentment. And we see a lot of this resentment in Black Lives Matter protests in the US and the response that white America is giving to these kinds of protests. So it goes on and on, and then but no country in the world right now best typifies the crisis of liberal democracy than the United States, where, according to Wolf, the profits orientation of the liberal system failed to make provisions for public health, resulting in the contradiction of the most wealthy country in the world having the highest infection and death rates from COVID-19 because profits and public health don't mix. So having just said that about the literature, just a brief overview of some of the things that have been said about how liberal democracy is failing and liberal democracies are in trouble. Let's focus on Africa specifically, where we can't talk about liberal democracy in the same sense that we talk about liberal democracy elsewhere in the world. But we talk about electoral democracy, what some of us call procedural democracy, where there's a focus on how people, the procedures of democracy, such as periodic elections, rather than the actual substance of democracy itself. So broadly speaking, Africa practices the electoral variant of democracy, which is a perverse form of liberal democracy, and this presents a scenario of double jeopardy for the working class and masses who form a large majority of its populations. Scholars have also interrogated the failures of this kind of democracy in Africa, electoral democracy, from different perspectives. We have people like Larry Diamond talk about the deteriorating state of democratic governance in Africa and focusing on two contending forces. He talks about formal and informal institutions on the one hand and the preference for democratic governance on the other hand, and how they have contended for dominance, a development that has been the hallmark of African politics between the latter part of the 20th century and much of the 21st. The prognosis of Larry Diamond's work, especially the one in 2008 on the state of democracy in Africa, reveals the troubling manifestation of ills of independent politics in Africa, evident in illiberal politics, lack of commitment to the rule of law, and the weak states of democratic institutions. Maybe because of time, not be able to talk about the different works like those of Adejumobi, Shola Omotola, that have been done on the crisis of electoral democracy in Africa, by looking at electoral violence, for example, which occurs during or before, during, and after elections. But one of the things that we can take home from all of these studies is that they have made remarkable contributions to the literature on the crisis of liberal and electoral democracy in Africa, but not many have actually explored this crisis from a public health perspective and what that means for Africa. And this is the reason why I'm interested in this subject, and the research is still ongoing, I must tell you. However, I would like to just give a few thoughts, on issues relating to how electoral democracy breeds corruption and bad governance, and that's how this made Africa largely unprepared for the COVID-19 pandemic and what that would mean. So concisely, given the colonial notions of state and governance that Africa inherited from the colonialists, government in Africa is not about developing the citizens and the state as we know in Europe and North America. Of course, Donald Trump is giving a different meaning to what state and governance means, all over the world. But, relatively speaking, Africa does not know state and governance as development machines. Rather, it is about exploiting the state and its resources for private ends, and politics is about competition between elite groups to capture the state to loot it for themselves, their families, and their friends. Now, in this sense, democracy became reduced to elections, which must be won by all means, including sometimes through the use of violence to capture power. The impact of that is that the people's understanding of democracy is therefore periodic participation in elections, not only as a means to participate, not as a means to participate actively in shaping their life circumstances based on the electoral choices that they make. So the exclusion of the people, from participating meaningfully in democratic processes that decide their life circumstances has emboldened corruption, enabled lack of transparency and accountability by the political beneficiaries of elections. So according to Kondreddy, for example, because development was never on the agenda, many states in Africa decayed. The social state declined, and the political state ascended. And then, of course, the public health system, as a consequence, was not spared. All right. So how does this impact on this eminent bad governance? How does it impact on public health in the continent? Now, although there are cases of democratic successes in Africa as far as governance is concerned, and you have notable cases like South Africa, Mauritius, Botswana, and maybe Ghana, but the vast majority of countries in Africa are convulsed by governance problems, with waning public confidence in government. Now, this is a result of the failure by governing elites in Africa to deliver on the social contract in the Lockean sense of why the state exists. And this is even when elections that produce governments that are said to be transparent, end up producing very bad leaders. And examples Nigeria, for example, in 2015, and then you also have the case of Senegal, Abdoulaye Wade in 2012. Now, while there are governments in Africa, which is one of the essential features of a state, there's a big question as to whether these governments are functional, because good governance that secures life, we're talking about the social state now, provides good public health infrastructure and other critical infrastructure that are essential for attaining citizens' happiness in the sense of the Bentham philosophy is a rarity in the continent. This is amidst large sums of aid that comes from financial institutions and governments in the global south, including Canada, and of course the wealth of the continent, especially from its raw materials, which have been largely mismanaged. So the resultant neglect occasioned by bad governance is currently affecting the continent in the era of a global public health crisis like we have right now. Now, what has happened is that COVID-19 has then recast light on the poor state of public health care in Africa. And, the United Nations Economic Commission for Africa, in 2020 said that Africa's healthcare system is the weakest in the world, and that's correct, with an average of 2 hospital beds per 1,000 people, and 22 countries in Africa at a risk of contracting health infectious diseases out of the 25 countries projected by RAND. So I'm not sure that I have time to go into the nitty-gritty of the kind of health systems we have in Africa, but it is usually the out-of-pocket model where the rich get medical care and the poor get sick and die, right? So for the rich, they either access medical attention by visiting private hospitals in their countries, and then where these services are not available, they travel out of the country. There are movements now in Nigeria and in South Africa where people are beginning to say, look, we should pass laws in Africa that prevent the political elites from treating themselves abroad and educating their children abroad so that they can fix the educational systems in the continent. Let me go straight to what needs to happen. I will just say three things. For Africa to be ready for the next pandemic, which may be in the form of a violent takeover by youths, we've seen evidence of this in Nigeria through the End SARS movement, it needs to rethink and redesign its states and political systems, as well as the governing regimes that they produce. Okay, so what do I mean by that? If the state in Africa is seen as an instrument of domination, as an instrument of exploitation, then it produces a notion of governance that is necessarily parasitic and antithetical to the development of the state or of the people. So we need to change our understanding of what the state means and what the state should be about. And then there should be a new understanding based on this rethinking of what governance, the kind of governance notions that we should have. That's one. Secondly, before the continent goes into these processes of redesigning its state systems, the African Union must, as a matter of urgency, make public health a public good, for everyone, and a human right of all Africans. And every state in the continent must see public health as the foundation of a wealthy society, and should therefore adopt universal health insurance policies. South Africa has already done this. Mauritius South Africa, has passed the law, but it's going to be effective next year. Mauritius is one of the countries in the continent that has universal health care systems for all citizens. And we think that COVID-19 has shown that, you cannot be prosperous in any sense if your citizens are not assured of health security. And then last point I would make is that Africa would also need the support of human development-oriented countries such as Canada, in the areas of accessing affordable vaccines, PPEs, and then also most significantly, any kind of aid that is given to Africa should be tied to building of public health infrastructure, across the continent. I'd like to stop there for now, and then maybe I'll have more to talk about this during the question and answer session.
Thank you very much, Christopher. All of those were just great presentations. So thank you all so much for participating and enlightening all of us on your thoughts with respect to health security. I wanted to identify very briefly a couple of themes that I saw, but then I'm going to turn it straight over to the questions because I think we've got some excellent questions and we have experts that we need to get answers from for these. But just briefly, in terms of the themes that I identified, and that obviously I think many of you have covered in your presentations, we see human health as a public good. Obviously, it impacts all of their institutions that we are currently concerned with. We might have once believed that the economy was the undergirding of society, but I think now many of us might believe that it is human health. We also have made clear that it's our interconnectedness, that this is not a local issue, and that as the pandemic has shown, the fluidity of the virus crossing borders and boundaries means that we really might have to think differently and not limit ourselves to past ways of managing disease. Jurisdictional impacts. There's many points that all of you raised with respect to how we might manage and take care of the individuals who are infected, how we might prevent infection. But all of this suggests to me that we might have to, and many of you have pointed out, rely less on state-centric solutions to these problems, such as the pandemic, but look to more towards a global kind of response. The last thing, and I'm going through this very briefly just so that we can get to the questions, but obviously there's going to be impacts for governance models, leadership and relationships. So as I believe it was Winston that talked about, there's new power differentials that will emerge going forward, and it'll be interesting to see how those how power might be reconfigured in the face of this pandemic, and how new relationships might be governed, and how the relationships between countries and between citizens will change in the future. I wanted to turn to the questions then. That was really brief. I've got pages of notes that I've taken from all of your presentations, but let's get to the questions. And one of the first questions that I wanted to have you answer, and I'll just throw this out to the panel more broadly, but if you were to advise your respective ministers of health in either your own region or the regions that you study, what would be the key pieces of advice that you might give those ministers going forward? Based on your experience and expertise, what do they need to know, and what should they do? So I'd like to just have any one of you jump in, and then we can go around, and if there's more than one answer, that's great. Otherwise, we would turn to the next question. But if I can call on one of you to tell us what you would advise our ministers of health within your respective region. Chris, are you able to respond to that? You're muted.
Sorry, I didn't get the question.
The question is, how would you advise the minister, any minister of health, maybe not necessarily to the minister of health in your respective area, but what are the things that you know that that person should be advised of going forward in the face of this pandemic, and making sure that adjustments are made should there be another pandemic?
Well, like you said, one of the things that we need to do is to shift our thought paradigm around what should be the foundation of society. Like you said, is it economics or public health? If it's public health, then it means that resources now need to go to building public health infrastructure, and making sure that there's investment in preventive health care. Those are the kind of things that can, apart from the leadership question, of course, that will help to contain. And then, of course, apart from that, put policies in place that will enable universal healthcare, at least basic healthcare for every citizen, irrespective of where they are. That's what I would tell my Minister of Health, to focus on.
Okay, that's very helpful. Thank you, Chris.
Erin, I would like to add on to that.
Okay, please. Yes, go ahead.
All right. So if I were to advise the minister of a country or region, I would definitely advise to look at the international health regulations. And then the reason why I advise this is that because I see the international health regulations can help building the capacities and the institutional resiliency in any country or in region. So the reason why I advise this is that, so I see interlinkages. IHR stands somewhere in between as an interlinkage between global health security, and then the health system strengthening, and then the universal health coverage. If I were to put these three bubbles, so I'll put international health regulations in the middle, because international health regulations have connections to these three bubbles. So I think a best investment is to, if we are in a position to build these capacities, so that means we are indirectly contributing to the strengthening health systems, contributing to the universal health coverage aspects, and then contributing to the global health security as a whole. So obviously, yes, my advice would be to look at the international health regulations.
Could I just add very briefly, one thing that I think is very important is to think about this, as I was saying, in a kind of multi-dimensional, transversal way, and also in a multilateral, but also multi-sectoral, multi-actor sense. So my advice would be, yes, talk to other members of the cabinet, talk to other governments, and have kind of joint ministerial meetings. And I think that's where the G20 can help there as well. So yeah, I would prioritize the importance of looking at this in a multiplex, transversal way, and not just narrowly in narrow policy silos.
Thanks, Jonathan. And thank you, Srikanth. Does anybody else want to weigh in on that question, or shall we turn briefly to the next one? Let's do that. So we have heard a lot about pandemics that are not managing as well, but are there examples that you would like to bring forward that are great examples of managing the pandemic thus far? Where are the bright spots, in other words?
Well, I'll start it. See, the bright spots, we have a few cases in Southeast Asia, like, for example, South Korea is one thing, and Singapore is one country, and we have New Zealand as one bright spot for sure, and few Nordic countries, as slightly mentioned in the chart box. And the reason why is that they were very proactive in screening measures, testing at the earlier phases of the outbreak. So that paid a good returns for them.
If I may, I just want to add that I dare say, in spite of everything I've said about Africa, that Africa also fared well, you know, in terms of managing, containing and managing the pandemic. Because, for instance, if you remember the prognosis, of course, the world always assumes that things like this will hit Africa the worst, and sometimes they're right, sometimes they're wrong, as has been proven in this case. The projections of infection and death rates in Africa were way higher than what we eventually saw. And they talked about 54,000 deaths in Africa so far, whereas the deaths were supposed to be in millions. That has not happened. It's largely because of the proactive action that a lot of governments took by closing the borders, daring to do that, and then using the resilience of the existing public health infrastructure, for instance, that deal with specific epidemics like the Ebola and smallpox, chickenpox. These are things that Africa has been dealing with in their own ways. And so when the pandemic came, they resorted to using these same ways to contain it. But of course, the usual problem of corruption crept in terms of managing palliatives, managing, intervention relief for poor people, and the fact that nobody expected it to be this long. So initially, Africa did well to manage through proactive action, but as time went on, and of course, there are other factors that contribute to why it has not been as bad as it was supposed to be. But I would say that initially, Africa did do well, and could be counted as a result as one of the bright spots if you want to look at Africa as a continent.
Thank you, Andy.
Sorry, Erin. Yeah, can I add as well that it's instructive to see that the five countries that have done best so far are Taiwan, New Zealand, Iceland, Singapore, and Vietnam. Taiwan had about 675 cases and only 7 deaths. New Zealand has about 2,059 cases and 25 deaths. Iceland has 5,390 cases and 26 deaths. And Singapore has 58,218 cases, but only 29 deaths. Vietnam has 1,347 cases and 35 deaths. So it's instructive to take a look at those and then compare them with the countries that have done worst. United States, number 1, Brazil, India, Mexico, and United Kingdom. And you have to ask yourself, what's wrong with this picture? I mean, countries that you expect to be much more prepared, have a much better infrastructure, health infrastructure in place, have done not very well at all. And countries with least preparation, sometimes they seem to do as well as, or even better than some of these other countries. I know a lot of the Caribbean countries have done it relatively well. I think a lot of it has to do with willingness of the populations to obey instructions. I think that is the bottom line, is that people are willing to obey instructions rather than to fight against the scientific evidence that's there. And as you can see from the ones that have done very well, countries like Taiwan has had a long experience in terms of building resiliency in their health infrastructure. And I think that's one of the reasons why they've done very well. Singapore as well is probably in that same category. So we have to really sort of rethink now how we look at this whole notion of preparedness and resiliency, and to ask some serious questions about how we can move away from this notion that just because a country has great economy and has done very well for themselves financially, that somehow they're going to be able to deal with these pandemics when they come by.
I'd like to add quickly, I think that's where, for me, the big issue is the policy response. So that's not just purely about your capacities, your resources, but also the government in place and the other levels of government. So as Jacinda Ardern, I think it was in New Zealand, said, go quick and go hard when dealing with this crisis. And I think that's it. And some other governments in the US, in the UK, I think the governments were just, partly because of their lack of experience with pandemics, perhaps, but they just didn't treat it as seriously as they needed to at the very beginning. And that's something that New Zealand got right, and some of the other countries mentioned.
Well, thank you all for your participation in the panel. I'm going to turn it over to Steve, but thanks again for sharing your insights. It's been a great panel. We've been allowed to go over time for a few minutes, but thanks again. So I'll turn it over to Steve.
Thank you, Erin.
Thank you very much. That was terrific. We really appreciate the global perspective we received. Obviously, there's much more we need to learn by looking at how countries reacted to the crisis, some of the things that were systemic across the world, and some of the things that were individual within countries. I really think the challenge is how does democracy respond to these crises really is something that everybody has a problem with, that these are really hard challenges. As I sit here in Ottawa watching how Canada is failing to manage this despite having lots of capacity, and finding that some countries in Africa are doing really well because they've never had any help. And they've always had more of a localized healthcare system. So there's a lot that we can learn from everybody. So again, thanks to the panelists for coming from wherever you are in the world. That was terrific. We're gonna take a break for about 15 minutes so people can grab a bite to eat. We're gonna have the ambassador for Women, Peace and Security, Jacqueline O'Neill, give a keynote speech. I'll introduce the person who will be interested in her, and then we'll have a conversation starting at noon. So we'll go to the usual background of the War Museum, and we'll come back in 15 minutes. Thank you very much, and I look forward to this afternoon's presentations. Thank you.